A lot of women turn to breast implants, whether it's for reconstructive surgery or cosmetic preferences.
Most of the time, women are satisfied with their implants, but there have been some reports of patients wanting them out.
There have been lots of headlines lately. So what are the safety risks that come along with implants? And we have morning anchor and health reporter Kirsten O'Connor standing by with a plastic surgeon in today's Ask a Doctor.
Well, good morning. I am here now with Dr. George Pope of Pope Plastic Surgery in College Park. We're so happy that you joined us today for this important topic. Thank you.
Happy to be here.
And I want to ask first, I know that you were telling us you've been getting a lot of phone calls after the FDA requested that Allergan voluntarily recall some of these breast implants. What are some of the patients asking?
Right. Well, as you can imagine, they're worried. You know, when a report comes out that implants can cause cancer, everybody kind of panics. But we encourage our patients to call in and ask questions. And they're asking, am I safe? What do I need to look for? And they really need to look for changes in their breast. If one of their breasts becomes larger, we look for fluid that may be around the implant. So if one of the breasts becomes larger, if it becomes painful, if they develop maybe a lump in their breast or in their armpit, well, they certainly need to call us.
And that's something in general that women have to kind of pay attention to, do self-exams, whether you have implants or not. We were also talking about how this type of textured implant is not all that common.
It's not. It's only about 10% of the implants used in this country. The textured implants came about in the mid-'80s to help combat capsular contracture or hardening or breast tissue being, scar tissue built up around the implant to make them feel hard. But we've found now that in rare cases, the body can have an adverse reaction to the texturing surface, and they can actually develop tumor cells. But the good news is it's typically curable, it's easy to diagnose, and you basically just remove the implants, remove the scar tissue. In rare cases, women might need chemotherapy or radiation, but that's in situations where they have a lump, an actual mass. In the majority of those cases, which are still rare, it's usually just fluid around the implant that we can remove.
Okay, so that's something you can see and you can remove. And Dr. Pope, we were also talking about the differences between these different types of implants. Can you explain a little bit more? Is there a visual difference when you actually look at the silicone or the implant itself?
Sure. Well, the smooth implant shell has been around for decades. And that's used in the majority of cases, like I said, in 90% of breast implant cases. The textured implants are more used for reconstruction after breast cancer surgery, but in some women it's used for cosmetic reasons. But the textured surface makes it look like a rough implant, and that increases the surface area, and that's what's implicated in this ALCL, the tumor that can develop.
And it's important to note too, I think there's a common misconception after this report was put out that this is not breast cancer. We're talking about ALCL is a type of lymphoma.
Exactly. It's a part of the blood circulation system, the immune system, if you will. And it has nothing to do with breast tissue. It has to do with your immune system having an adverse reaction to the textured surface and bacteria that can be around it. And one point to make is it typically it doesn't even occur until maybe 8 to 10 years after you've had the implant. So it's a late complication or late problem.
Interesting. Yeah, that is important for people who maybe had their implants many years ago. Those are the people that maybe need to be thinking about this more.
Sure.
And
they
again,
always look for changes.
Yeah, if they're the textured types. Another thing I think that's important is whenever we have news about breast implants, any type of headline, people start talking about the mystery breast implant illness, which is not diagnosable and is something that's still kind of hot on the internet, but not something that doctors have really diagnosed. What would you say to people who, maybe call and ask that question? Is this related to that mystery breast implant illness?
Right. That's something, you're referring to something that came about in 1992. The FDA put the brakes on our use of silicone gel implants until we could prove their safety. And after 14 years of study, we never really found any link between leaking silicone gel implants and any of the diseases I thought might be related to the autoimmune group of diseases. This, however, is totally different. It has to do with adverse, like chronic inflammation in situations where the implants have that textured surface. So this is not at all related to that, but women still call. They wonder, is this related to the issues decades ago.
Right, and so you are getting many of those calls right now, and you told me you're welcoming the patients asking these questions.
Right. We ask them to come in, and I'll ask any woman who's concerned, who has implants, whether they're textured or smooth, to call your plastic surgeon, try to come in and at least talk to him or her and find out what your risk is. And the risk, once again, is very, very low, and the textured implants are not as commonly used. But they do need to call if they're concerned.
Yes, we welcome everybody asking the doctor. That's why we have this segment. Thank you, Dr. Pope, for your time and your expertise. I will send it back to the ladies at the desk.